Welcome back to Fox 51 today. You know, atrial fibrillation, it's a common problem.
Oh yeah,
It's a very bad problem too, but thankfully today Dr. Stan Weiner is here to explain to us some more about some of the treatments and things that can help us. Good morning, Dr. Weiner.
Good morning. Pleasure to be here.
Well, thank you for coming by. You know, first up, for those that maybe not be familiar with atrial fibrillations, can you kind of explain to us what exactly that is?
Atrial fibrillation is an extremely common medical condition. It is the most common abnormality of the heart rhythm. Just like any other pump, the heart has an electrical system that keeps it running smoothly. When that gets disturbed, the heart runs inefficiently, frequently causes a lot of symptoms. Shortness of breath, palpitations, weakness. Atrial fibrillation is one of the most common causes of cardiac hospitalizations and is the leading cause of stroke in our patient population.
What can really cause it? Related to the electrical impulse, right? But what are some of the causes of that, of atrial?
It's a challenging condition in that many different things lead to atrial fibrillation. Abnormalities in overall heart function, like old heart attacks or leaky valves, tend to cause atrial fibrillation. Hormone disturbances such as thyroid disease may cause atrial fibrillation. In many patients, atrial fibrillation has no identifiable cause. We don't know why it happens.
Mm-hmm. And you were saying atrial fibrillation can actually increase your stroke risk? Is that what you were saying?
Atrial fibrillation by far is one of the most common causes of stroke, and that's what makes us very concerned. A few weeks ago, there was a new update to the practice guidelines that was put out by the American College of Cardiology, American Heart Association, and the Heart Rhythm Society, looking at how we practice in preventing strokes and other problems related to atrial fibrillation. There's a new emphasis on looking at the risk factors for stroke, some of the old risk factors like high blood pressure and diabetes, congestive heart failure, but also some of the newer risk factors have been incorporated in our treatment strategies. Did you know that as a woman, you have a much higher risk of stroke in the setting of atrial fibrillation than a man? These are some of the new changes to the way we practice in this area.
So is this something that people are, in some cases, I guess, could be born with?
Unfortunately, some of this is genetic and poorly understood. People may sometimes have this type of a problem. It typically happens in the older age, and usually we don't see it in kids, but as people grow older, it becomes more and more common problem.
Mm-hmm. Now, how do you go about treating this sort of problem?
The number of different treatment options that we have, they include medications, a variety of different medications. There's also a number of procedures. One of the new changes in the practice guidelines that was put out a few weeks ago is that there is much greater emphasis on using catheter ablation for treatment of atrial fibrillation. These practice guidelines are based on the clinical trial data that has been accumulated over the last decade, and it shows that ablation tends to be much more effective in many patients with atrial fibrillation than medical therapy. So it is a highly individualized treatment strategy where you need to look at the patient and look whether they're a good candidate for a procedure or a good candidate for medications and select it. But it's certainly something that should be looked at by physicians who have good expertise in a variety of different treatment options.
And the catheter goes in at some point. Is that usually in the leg somewhere?
Yes, the procedure is done similar to a heart catheterization. It's a small electrical wire is inserted through the blood vessels in the leg into the heart, where we find spots for abnormal heart rhythm, scar tissue that's causing atrial fibrillation, and try to burn it out. We've had quite a bit of experience with that. We've been doing catheter ablation for the last 8 years here in Tyler at Mother Frances and the Louis and Peach's own heart hospital. We've had quite a bit of experience. We've done over 700 ablations over the last 8 years. What we've seen is, while it doesn't work for everybody, it certainly is a great treatment option for a large number of patients with atrial fibrillation.
All right, well, I mean, this is some great information. Thank you so much for stopping by this morning, Dr. Weiner.
Thank you so much. It's been a pleasure talking to you.
Appreciate it.
Thank you. Well, coming up on Fox